Welcome to OncoLife interview session. It's my pleasure to introduce our guest today, John Santini, President and CEO of the Vergent Bioscience. Thank you so much for joining us, John.
Thank you very much for inviting me to speak with you today, Hussein. It's a pleasure to be here.
You're welcome. In this session, we will explore the exciting clinical research surrounding the intraoperative molecular imaging with the Abenacianine for injection. This innovative approach aims to enhance tumor visualization during the lung cancer surgery. So, could we start with some information about your professional journey and mission of the Vergent Bioscience?
Sure, I'm happy to share a little bit about my background. I grew up in Michigan. I've always enjoyed science. It was an early diagnosis of lupus at age 12 that sparked my interest in medicine. I attended college at the University of Michigan, followed by MIT, and ultimately decided to follow or focus my professional career on being a startup entrepreneur and trying to address really difficult medical problems. I'm blessed to have a loving and supportive wife and kids, and my wife and I met when we were at MIT working on our PhDs. And I will say that everything that I'm going to talk about here today at Vergent and throughout my professional career, a big part of that is really because of the support my family gives me, and they've been really wonderful. And in sort of riding the ups and downs of being an entrepreneur all these years. And I will say we based ourselves in Minnesota about 13 years ago. Happy to raise our family here. And I was introduced to Vergent just shortly after I got back to Minnesota. I was new to molecular imaging. The science was fascinating, however, and I really wanted to dig in. And so we decided to focus Vergent on human cancer surgery, and we found this molecule developed in the laboratory of Dr. Matt Bojo at Stanford. And from that moment, the company was born. And, the Vergent mission is quite simple. It's to help surgeons find difficult to find or previously undiagnosed or undetected tumors in real time during surgery so that they can safely and effectively remove all the tumor tissue.
Before diving into the details of the visualized study, can you briefly explain how the intraoperative molecular imaging with the Abenacianine advanced the surgical oncology and why it's important for the cancer surgery?
No, absolutely. Intraoperative imaging with Abenacianine really helps support the shift that's been occurring in surgery over the last 15 to 20 years from open surgeries to minimally invasive procedures. And this move to minimally invasive procedures, including robotic-assisted surgeries, have generally reduced the serious surgical complications, decreased post-surgical pain, shortened hospital stays, and recovery times. And however, this move to minimally invasive surgery doesn't come without a cost. Surgeons have a more constricted workspace inside the patient. Lighting and their view of the surgical bed is limited. And more importantly, we've taken our hands of the surgeon, one of their most important tools, out of the patient. And that greatly limits the surgeon's sense of touch. And Abenacianine was developed to help improve tumor visualization for the surgeon during the procedure, while they're in the patient, when these limitations of minimally invasive surgery are the most apparent. And so, in short, we're lighting up tumors, and we're doing this so that the surgeon can make better informed decisions and possibly even revise their surgical plan in real time.
The visualized phase 2 study showed that the Abenacianine identified the tumor in the 45% in surgical cases that were missed by the standard surgical techniques. What does this mean for lung cancer surgery patients?
Sure. The purpose of these efficacy studies hasn't been to see how often we can light up the tumor. This happens nearly every time. What we're looking to do is to provide actionable information to the surgeon that they would not otherwise have, and which could allow them to modify their procedure. And so the primary endpoint of our phase 2b visualized study was the proportion of patients that had at least one CSE, or clinically significant event. And these can be categorized into 4 areas. That's helping the surgeon find a tumor they knew was there by preoperative imaging, but they couldn't find it when they were in the patient, finding additional tumors that were not previously known, identifying inadequate resection margins, or identifying lymph nodes that contain cancer. So that means in 45% of cases, at least one of these 4 things, one of these CSEs occurred. And what that means practically is that in 45% of cases, the surgeon received actionable information from abenacianine that they would not have otherwise had, and which allows them to make more informed decisions about whether they want to stay with their current surgical plan or modify that plan to get the best outcome for the patient. And I'll give just one brief example that I think will outline sort of the importance of what I mean by these clinically significant events, or this primary efficacy endpoint. So we had a particular patient that had prostate cancer, and it had metastasized to the lung. On preoperative imaging, they knew they had a large prostate met in the lung, and they went into the patient to remove this. Abenacianine lit it up really nicely, helped the surgeon see the borders, helped them understand where they wanted to cut, and move forward. Now, the more interesting thing is, as they were getting ready to finish the surgery, they did the inspection of the thoracic cavity, which they usually do, to see if there's anything they may have missed. And they saw a small spot, just a couple of millimeters, that lit up quite nicely on the pericardium, or the lining of the heart. This is something that never would have caught their attention. And in fact, even once they identified it, they said, wow, I never would have seen this. I never would have noticed this was abnormal. And they cut this little piece of tissue out and checked it by pathology, and sure enough, it was cancer. So as a result, they were able to remove this additional cancer that they didn't even know was there. They didn't even know to look for it. And you can imagine what the outcome would have been had this patient not been on the trial and had the benefit of using abenacianine. The surgeon would have unknowingly missed this tumor. They would have sent the patient home thinking they resected everything. And probably 6 months or a year and a half later, they probably would have shown up to the ER with difficulty breathing or some other issue. And sure enough, they probably would have found a large tumor on the heart, which, as you can imagine, would not have been a good situation. So these are the kinds of cases where abenacianine could provide this extra information to the surgeon that they wouldn't have otherwise normally had, and they can take action based on that information.
The study included a variety of the tumor type, including the primary lung cancer and metastasis. What are the differences in Abenacianine's performance across these histologies?
Yep. Now, many different types of tumors end up in the lung, and we wanted to make sure that the trial population really reflected what surgeons would see in the real world. So we did not limit the type of tumor pathologies or histologies of patients that could come on trial. And tumor breadth was one of the primary attributes that attracted us to the work of Professor Bojo at Stanford, and specifically abenacianine. We target, this molecule abenacianine targets cathepsins. They're a family of proteases that are highly overexpressed in a broad range of solid tumors. And by binding tightly to these proteases, abenacianine is retained at the tumor site during the surgical procedure, generating a really nice, sustainable molecular signal that's visible using a near-infrared camera. And thus far, our trials have confirmed the original thesis that one drug could target many different histologies. And we've seen that in these trials to date, not only in the phase 2b trial, but in our earlier trials. As you mentioned, we've seen primary lung tumors like adenocarcinoma and squamous cell carcinoma, but we've also seen other kinds of tumors and metastases, breast tumors, colon, rectal, prostate, both soft tissue and osteosarcomas, neuroendocrine tumors, and even lymphomas. So we've been very pleased by the fact that that original idea that we set out with, that one drug could address all the kinds of histologies that we might see in the lung, that's held true to this point, and we've been very pleased.
The visualized study also showed that the Abenacianine helped with the margin assessment and the lymph node detection. How could this change the lung cancer surgery?
The goal of of cancer surgery in general is to ensure that all cancer is removed. And the assessment of margins and lymph nodes can play a really important role in achieving this goal. Margins are universally recognized as important in surgical oncology across all solid tumor cancers, not just lung, but in all of them. It's well established that if you have an adequate margin, this is predictive of a better outcome. And the challenges for surgeons in the real world are knowing, one, where the tumor is located, and two, where to cut to get an adequate margin. And right now, it's for difficult to find tumors. Those that are under the surface are very small. There's a bit of guesswork that goes on as to where to place the stapler to cut tissue. In our trials, we've designed our trials to gather data that's going to help provide the confidence that surgeons need that fluorescence is a reliable indicator of the pathologic tumor edge. And a key goal for Abenacianine is to serve as a real-time intraoperative guide for stapler placement and to know where to make those cuts, removing some of this guesswork from the process so that the surgeon can have adequate margins every time. Now, lymph nodes, they're important in determining whether a cancer has spread. And this assessment plays an important role in determining what happens to the patient after surgery, what kind of treatment might be recommended. If all the nodes are clear of cancer, then treatment may stop. They may be considered surgically cured of their cancer. But if there are positive lymph nodes, then post-surgical chemo, radiation, immunotherapy, any of these, any or all, or some combination may be recommended. And we believe that Abenacianine can help draw the surgeon's attention to lymph nodes that may contain cancer, and that'll just decrease the likelihood that they're going to miss it during the procedure.
Abenacianine is compatible with the existing near-intraoperative imaging system. How do you see it fitting into the current surgical workflow, especially in minimally invasive and robotic-assisted surgeries?
Well, from the beginning, from the moment Abenacianine was invented, it was designed to incorporate indocyanine green, or ICG, which is a dye that's been around for more than 50 years in surgery. And we did that specifically and intentionally so that surgeons could use the equipment that they already have available to them in the hospitals without any modification. And this broad device compatibility allows Abenacianine to integrate really seamlessly into their existing workflows, both for minimally invasive as well as robotic-assisted surgery. And if Abenacianine is approved, this feature, we believe, will be a really important part of adoption, since hospitals will not need to go and acquire expensive new capital equipment or software modifications in order to use the product. Currently, there are no commercially available molecular agents that are compatible with the market-leading robotic surgery platform. And we think the ability to use Abenacianine with this robotic platform will indeed significantly enable significantly greater patient access to the technology.
And finally, surgeons' confidence and the decision-making are critical during the surgery. How do you see Abenacianine helping with real-time decision, especially in the complex cases?
Surgeon confidence is so important in choosing a minimally invasive procedure over a more complicated open procedure. And, our goal has always been Abenacianine. We can provide this information to the surgeon that they can incorporate into their decision-making and trying to help increase that confidence level that all the cancer was removed. And so, just as an example, locating the tumor and understanding its size and its extent, where if it's reaching into critical structures or looks like it's spreading, that helps them decide in real time if the procedure they plan to do is still the right choice, or if they need to make a decision and choose to take more or less tissue than they originally planned. If those margins are too close, the surgeon may decide they need to take more tissue to give them some comfort, give themselves comfort and confidence that they've removed it all. Or after product approval, it may even be used to help guide the placement of their stapler and help guide where they're going to make those cuts. And so the significance of the results from this pivotal study can be summarized this way. Abenacianine provided, really important real-time information that the surgeon could do something with. It could help make decisions about the procedure in nearly half of all patients that were on study. Nearly half. That's pretty substantial. It's very material. And I'll really end in sort of, again, talking about another example, because I think examples really hit home the potential of what, along with surgeons, we can do for some of these patients. So there was a case in this study where a patient had 2 tumors in their lung that were identified by preoperative imaging. One larger tumor in the right upper lobe. The surgeon didn't believe they would have any challenges finding this one. But more importantly, there was a small tumor in the right middle lobe. It was what they call ground glass opacity. It's a small semi-solid tumor that's under the surface usually. It can be very difficult to find for the surgeon. And without our agent, the surgeon's plan was they would leave if they can't find this small tumor, this GGO, they would leave it behind until the tumor grew bigger, and they would have the confidence that they could go in and find it and not have to take too much healthy tissue in the process. So it would involve a second surgery. When they went in to the patient using abenacianine, it made it possible to localize that small tumor. It lit up beautifully, and you could see exactly where that small 2 or 3 millimeter diameter tumor was. And it allowed him to make that decision in real time to take a small wedge resection of that tissue and remove it. And as you can imagine, the importance here is that it helped avoid all the anxiety that patient would feel over the next several months as this tumor is growing inside them until it's large enough and then, having to go back in for the trauma of a second surgery. So these are, this is just an example of how this ability of providing real-time information about where a tumor is, what those margins look like, helping to draw their attention to positive lymph nodes, how we can have an impact for patients, in real-world settings like lung cancer.
Well, I have finished all my questions. I don't know, do you want to add something else or underline anything from this discussion?
Yeah, I'll just say that one thing that we're really excited about, as we've proven this thesis that we've got the ability to light up a wide range of tumor pathologies, being able to confirm that in these lung cancer studies have really energized us about the potential for abenacianine to be used in other types of cancer. And so it is our plan that after we get our lung cancer approval for abenacianine, that we will move on and pursue the use of abenacianine in the visualization and detection of other solid tumors such as breast cancer, colon cancer, rectal cancer, prostate. And this is really exciting to us. It shows that the work that we're doing today is just the beginning of what we hope to accomplish. And I think there's a lot of exciting times ahead, and we're really looking forward to the future.
Okay, thank you very much for joining us today. And
it was a pleasure to be here. Thank you for having me.
Thank you.